And now I'm going to move us into our next session with Ruth Northway, who's Professor of Learning Disabilities Nursing at the University of South Wales. And Ruth is going to talk to us about some research she's done with colleagues in Wales on the All Health Wales profile. So over to you, Ruth. Thank you.
Okay, thank you. Thank you everybody for this invitation to speak this afternoon. I want to speak to you about a piece of work which we've been doing in Wales to develop the All Wales health profile. Now, some of you will be familiar with health passports.
Okay.
And this is an approach which we've used in Wales to try and develop one tool for across the whole of the country. And
which one?
what I would like to sort of say is that how it fits in.
When I went away. Yeah.
Ruth, sorry, I'm going to stop you there just for a second. We've just got somebody who's joined us who needs to go on mute. Can I just remind people to mute themselves, please? Just give you a second to do that.
Thanks, Carrie. They're muted.
Thank you.
Okay.
Okay, Ruth, sorry.
Okay, no problem. Okay, so yeah, as I say, I'm going to talk about the All Wales health profile that we've developed here in Wales. How it fits into this sort of particular sort of session today, I think, is in two ways. One, it is about working together to produce something which hopefully is going to help people in day-to-day lives and day-to-day practice. And it's also about, I suppose, linking back to what Peter and Christine were saying at the beginning about the need for people to know about the health needs of people with a learning disability. So if I just give you a little bit of background to this project. Back in 2017, myself and some colleagues looked at a lot of hospital passports that were in use at that time. I think we probably looked at about 16 total. And what we did was look to see what they looked like, what information they contained, and how long they were. And what we found was that there was a lot of differences in terms of how long the documents were. Some were 3 pages, some were, I think, up to about 30 pages. They looked very different. So you wouldn't automatically perhaps look at one and say, oh yeah, that's a passport, that's a communication tool. So they looked very different. And the information that they contained was also very different. So for example, some of them that we looked at didn't have information about allergies that people might have, which we thought was pretty important. Excuse me. And what we felt was that the fact that there were so many different tools in operation meant that there were some implications for patient safety, because sometimes people might not recognize the tool. And I know we've probably all heard a lot of people sort of say, well, you know, I've taken a hospital passport to hospital with me and it wasn't used. You know, is that because people don't recognize it and, as you know, don't recognize why it's important? We also thought that it was really important that people can find information quickly in these documents. So, you know, the example I usually think of is if I was a nurse working in an accident and emergency department and somebody gave me a document, I'd like to recognise it. So I'd like to know why it was important, but I'd also like to know where in that document I could find information. So, you know, it'd be really helpful for me if I knew that, for example, on page 2, I would find the information about the medication that people are on, rather than having to go through the whole document to try and find that. So what we thought was it was really important to try and have a single document that everybody would recognise and everybody would use. So that sort of led into the project that we've been working on. And back in, I think it was August of 2019, Improvement Cymru, who's a group within Wales who are part of Public Health Wales, and they look at service improvement. They asked people to put in applications to develop an All Wales health communication tool for people with learning disabilities. Because of the work which we'd done beforehand, myself and colleagues at the University of South Wales put in an application and we were lucky enough to get the funding. So I've worked on this with my colleagues Edward Aloidi and Stacey Rees. What we felt was that when we were going to develop the tool, we needed to really get everybody involved who had an important view on that. So obviously it was important for people with learning disabilities to be able to decide what information they thought it was really important for health professionals to know about them. But we also thought it was really important for health professionals to be able to say, actually, this is the information we need to provide good care. So what we did was we approached it from the idea about how do we provide safe care for people with learning disabilities, not just in hospital, but across all of the different settings, health settings people might go to. So we decided to get information from two main different sort of routes. We did an online survey, so we produced a questionnaire which went out, anybody could answer it, and in it what we asked for was where people were, what was their interest. So were they a parent or carer, were they a health professional? If they were a health professional, were they working in learning disability services, or were they working in general health services? In the survey, we asked them to identify from a long list of pieces of information that are in existing health passports, what do you think are the most important? So we asked people to identify what they thought were the most important 10 items out of this list of about 39. And then we also asked them how long they thought a document should be, what format it should take. So should it be paper? Should it be online? Should it be both? And finally, we asked people for any other comments. And I have to say, a lot of people took the time to give us comments. What was really nice was we got responses from a wide range of people. So we did get health professionals, but from a lot of different professional backgrounds, some working in learning disability services, some not, some in primary care, some in hospitals. We had parents and carers, we had social care staff. So it was a very good mix of people we had. But we were also aware that an online survey was not the best way to get information from people with learning disabilities. And it was really important that we had that information. So what we did was we did 4 focus groups with people with learning disabilities. So we met with 4 different groups. And how we approached it was we took the items that we had in the survey, so the different bits of information. So for example, things like, things I am allergic to, what's my name, what's my current medication. We put all of those on separate cards. So we could do a sort of a card sorting exercise. And we asked people to identify what was important to go on the document and what wasn't so important. So, okay, so now my slides don't want to move on. Let's see if I can move it on this different way. Okay, there we are. So when we got the information back from the survey, over 70% felt that the document shouldn't be more than 4 pages long. They thought it should be short so that people can find the information easily and that it didn't take a lot of time to read through. But at the same time, people felt that all information was important. So people would say things like, well, I know it's got to be short and I want it short, but actually you should do this, this and this. And that's a very difficult thing to try and balance. How do you make sure that the document is short, but at the same time you've got all that important information there? Well, what we found from both talking to people with learning disabilities in the focus groups and the results in the survey, but there were some broad areas that people were agreeing on that were really, really important. And one of the most important things that came to us was actually from the focus groups, from the people with learning disabilities, who said to us, well, actually, this bit of information it's not important for me, but I know it might be for one of my friends. So they used examples like religion. Some people said, I know that's important for my friends, but actually, I don't think it's important for health staff to know that about me. So what we decided from that was that maybe we didn't need to have a document that got lots and lots and lots of questions. It was probably better to have some broad headings which would allow people to write what was important for that individual under those headings. So what we came up with in terms of recommendations was that it shouldn't be more than 4 pages long. We should have broad headings, and obviously one of the themes going through this sort of session today, but I think also some of the others, is about person-centered care. So actually having broad headings rather than a lot of information which may not always be relevant to people would actually allow perhaps greater personalization. It would allow people to put more information which was particular to that person rather than sort of general information. We wanted it to include those areas where people had told us they agreed more or less that these were the most important areas of information. But we also felt that it wasn't enough just to produce a document. So we recommended that there should also be guidelines to help people think about how to complete it and also how to use it. So what we did was we developed a sort of what we call a prototype, we developed something which was going to be how we thought the document might look. We also developed some guidelines about how it could be used, and then we met again with people from a lot of different backgrounds to say, look, this is what we've done, this is what we're recommending, what do you think? And that was really, really helpful because we got some really important feedback from that. So for example, one of our colleagues who worked in a general hospital said, actually, if you can produce something that looks like it's a health document, people will then recognize it more and they will find that easier. They'll know that it's something they've got to pay attention to. Other people were saying, well, actually, perhaps we need to have a bit more space on this particular topic rather than that. So it's really, really important that we did that. We made some changes on the basis of that, and then we produced the final versions and sent them to Improvement Cymru. So what you have on this slide is, I've just given you two of the sheets of the 4 sheets on the adult one. A child one has subsequently been produced. But so you can see from this that they are broad headings that people could have got the space to fill in. And the idea being, obviously, at the front page, if you're working in a hospital, you recognise it, you've got some key information there. You know that actually, if you want to know about people's medical history, you want to know about the medication, you're going to find that on page 2. And that's really important, particularly in an emergency setting. But as I said, what we have done as well is to produce some sort of guidance notes. So we have them for people with learning disabilities to give them some ideas about how they should be filling that in. We've also produced them for families and carers who either might be filling the forms in themselves or might be supporting other people. And that gives them a clue as to some of the things that are important under those different headings that they might want to put in. And then we've also produced a third set for health professionals because we felt it was really, really important that health professionals had some help to understand why this document was important and how they should be using it. Of course, just producing something doesn't mean that it's going to happen. So what we've also been doing is working with Improvement Cymru to try and take this forward in terms of implementing it. So because of COVID, we had to have an online, what we call soft launch. So we did that last June. We also did a webinar during Patient Safety Week. If you remember, I said that we were trying to focus this very much on safety issues for people with a learning disability. But there's also a lot of other work that has been going on. So, for example, one of the People First groups in Cardiff, they've actually got some funding to develop some peer support to help other people with learning disabilities fill in these forms, to try and help them to understand why it's important and to make sure that they've got one in place. Some of our students, so as people are probably aware, when we've looked at the during the COVID period, it's been quite difficult sometimes in terms of placements, people having to work at a distance. So in some instances, some of our student nurses have actually supported people to be filling these in as well. And we've got lots of different groups of people sort of championing it. So, people like MenCap Cymru, people like Learning Disability Wales, people like the All Wales Forum of Parents and Carers, All Wales People First. So lots of activity going on to try and get it so that people are all aware of it. And that's been linked into a social media campaign. And recently we just produced a sort of a cartoon type, very short clip, which just again explains the importance of this. What I've done is I've given you the link there to the Improvement Cymru sort of website, and on that you can actually download the health profiles if you're interested in those, and also the guidelines, and you will also find the animation on there as well. So I think I'm just about within time. Carrie hasn't waved anything at me yet, but I think I'm just about in time. Obviously, I'm happy to take any questions if there is time today. But if not, what I've also done is I've shared there my email address and also my Twitter handle if people want to get in contact. So thank you for listening, and I hope you found it interesting.
Ruth, thank you very much indeed.